Hi everybody, my name is Lindsay Marquardt. I am a pediatric physical therapist in Saginaw, Michigan. I've been doing this job for over 8 years now, which seems like it's been forever. It's really cool. I've been working in pediatrics specifically for 8 years, but there's a whole host of different areas of PT that you can work in. I just have chosen to specialize in pediatrics. So my typical patient population is birth up until, up until 18, but sometimes even longer based on the condition or what's going on with that specific person. Right now I work at Mary Free Bed at Covenant, which is a hospital-based system. So there's nursing and there's physicians and there's acute care. I work in the specific physical medicine and rehab department, and that's your rehab services. So OT, PT, speech, maybe like a recreational therapist, things like that. So previous jobs that I have held that helped me get to this point, a lot of volunteering, a lot of shadowing at tons of different clinics, because like I said, there's a lot of different areas of PT that you can go into. So to know who you want to work with and what kinds of conditions that you want to work with is really important, and just to know how a PT clinic functions, both hospital and outpatient. Outpatient is kind of more that potentially private practice or something like that. To be a PT right now, you have to get your doctorate. So you have the bachelor's, which is the first 4 years of undergrad. I got mine done at Hope. And then there's a handful of schools in Michigan, and then there's more out of state that offer a doctorate of physical therapy program. I went to Central, and that's an additional 3 years. So it's a total of 7 years after high school graduation to get your doctorate, and then you are ready to treat. About 2 years ago, I went for my clinical specialty in pediatrics, and that was really just a really long test, but I studied for 6 to 8 months for it, but that means that I am certified and specialized in the treatment of pediatrics. So my daily schedule, it changes and it ebbs and flows, but I'm working with patients, and specifically, I'm working with families. When a child specifically needs physical therapy, it can be pretty emotional. Sometimes it's for something minor. They may have a tight muscle in their neck. Maybe they broke their leg and need help using crutches. Maybe they are having pain in their hip or knee or ankle or back or something like that. But it could be things more serious. It could be diagnoses like genetic disorders, like Down syndrome or Edwards syndrome, obscure genetic deletions. There are birth traumas that can result in something called cerebral palsy, where there's a lack of oxygen to the brain that right around birth, maybe before, during, or after birth, that can lead to challenges like increased muscle tone, challenges with balance, difficulty walking. I work with babies who are born premature. So when they are not born the full 9 months, when they don't get that time to develop in utero, there can be some really major things that happen. They're at a higher risk for brain bleeds. They're at a higher risk for muscle tone challenges. And then they're just typically behind because they didn't get as much as they needed with it. So it's pretty emotional sometimes with the families too. But that's my job, to bridge that gap, give them exercises to do, and then also treat them. I treat a lot with my hands. With babies, I treat a lot with my hands and my feet, and they're kind of in my lap. I do a lot of my treatment sessions on the floor, helping them roll and crawl and strengthen their chest and back so they can do those things. Even little kids, babies, toddlers, they have very specific things that they're supposed to be able to do at certain ages called milestones. And if you don't hit those milestones, or if there's a reason or something blocking those milestones, it can cause challenges down the road. So that's my job as well, is to identify what's in their way and then figure out how to make it work for them so that they can overcome that obstacle and be able to work towards sitting up on their own. Work towards learning how to walk and crawl. And that is one of the huge satisfactions of my job, is that I get to be there to celebrate those victories with the patient and with their families. I've taught a lot of little kids how to walk, and kids that even doctors said wouldn't be able to walk. A fun story, I treated a little boy, I still do. He comes on and off. He's not here forever. He comes here for maybe a couple months and then takes a break, and then comes here and then takes a break. He is one of 4 people in the world with this genetic diagnosis. It's very, very rare. He was not supposed to live past he was 1, and here he is now 3.5, and he is rolling, and he is being able to play, and he can sit up on his own. So really, just because he's 3.5 doesn't mean that I'm always working on other things that other 3.5-year-olds might be able to do. It's really important to meet them where they're at and then try to make it more functional so that maybe they can sit up on the couch and play. Maybe it means that they have enough head control to sit in a wheelchair and interact with their siblings. You're always looking for what is going to impact their quality of life, what's going to make their life better and just more impactful, what's going to bring them joy, things like that. And with kids, it revolves a lot around play. So I do play a lot. And actually, I wanted to give you a little tour of, this is not the whole place, but this is our big pediatric gym. So I just kind of wanted to show you some of the equipment that I get to use every day. This is a toy closet. It's full with baby toys. This is a stability ball. It's 120 centimeters. So I'm 6'1", but it kind of goes up to my waist. And we put kids on there a lot, sitting, standing, walking. It's awesome to use for balance reactions. We have a swing, and we actually have quite a few different swings, but it's suspended. So it will go back and forth, and then it also spins and twists. And a lot of these look like play type things, but we're trying to meet them where they're at. Like I said, kids want play. That's their job, is to play. So we need to make sure that we're meeting them with where they're at as well and make it very kid friendly. So here is a whole host of things, but we have some adaptive tricycles. And then here are a bunch of different kinds of walkers. So this is a reverse walker, and then we have a gait trainer. So they can put their chest right here and face out. This will wrap around them. It's adjustable on so many different levels. This is called a scoot, and this is actually pretty cool. So this is commonly used in kids with spina bifida. Doesn't have to be, but typically is. And this keeps them low enough to where if they can't, on spina bifida, it's an injury to the spinal cord, and it's actually a failure of development where it doesn't close when it's supposed to very early on when they're in utero. But they typically don't have a lot of function in their legs, so this gives them the opportunity for mobility within their home. So they sit here, this supports their trunk, and then these wheels are nice and close, and they can scoot themselves all around the floor when they aren't able to crawl and walk like a typical 8, 10, 12-month-old. This gives them that opportunity. There's a couple of more gait trainers. Here's another different kind of walker. This is called a croc. This one right here, actually this red one, is a bath seat. Because again, you're looking at the patients as a whole, their patients in their life. If they can't sit up, bath time is very, very tricky, especially if they're little and they can't sit. It's not always safe to shower with them. I mean, like, how are you going to bathe them? They might be too big for the sink. Like, you know, you have to think of some of these things through. So another piece that is my responsibility to recommend what piece of equipment they need for home. And then I have to go through a lot of hoops with insurance and paperwork to help them get that. Sometimes there's a cost, sometimes there's not. It depends on what insurance coverage. But it's my job to write that letter and advocate for the patients and fight for them so that they can get the things that they need. Some of the challenges that I face is, it stems off what I said was was the pros, but I'm working with families and it's emotional. So sometimes parents don't understand. Sometimes they are emotional and may not be ready to accept what their future holds. Therapy can be very trying on a family, especially if there's siblings or if they have to drive a long way. Therapy can be intense. We do send home exercises as well to keep working on it at home, but it can just be a lot to be put on a family. Also, children don't always cooperate. So like I said, I get to help little kids walk. But if they're 18 months old and they don't want to walk, we want them to. That's what's best for them. But I have to make it fun for them, because if they don't want to do it, sometimes they'll just sit or they'll cry or things are hard, and little babies don't love to be challenged. So sometimes I do deal with some tears and some frustrations and some fighting back a little bit, not aggressive fighting, but more just resistance. But I have to figure out how to make it fun and how to make it functional. I have to figure out how I'm going to facilitate, which means like turn a muscle on with my hands. So I have to know a lot about anatomy and the direction of the muscles and how they work. What muscles are turned on during what activity. So if I need to work on something in the walking, I need to look at that exact moment, like freeze, figure out what muscles needed to be turned on, and then come up with a bunch of exercises to turn that muscle on while playing with a 2, 3, 4, 5-year-old. So making it fun, making it silly. It is such a rewarding job. Like I said, I've been doing it for 8 years. I couldn't imagine doing anything else. The future of PT is awesome. They're constantly coming out with new equipment pieces, new techniques, new research on the best outcomes. There's a couple of other things that we don't specifically have at this clinic, but you can do aquatic therapy with kids, which is awesome. We do have a robotic gait trainer in a different room. That's really cool. Behind me is a rock wall that we use, and then that is a light gait, but basically there's a harness that holds them up, or partially holds them up so they can't fall. It's another way we can work on kicking, standing balance, and it gives me a couple of extra hands, if you will, so that I can work on something else and help support them at a different level. So I hope this was informational and enjoyable for you guys, and just reach out to Mr. Potts if anybody has any questions for me about PT in general or specifically pediatric physical therapy. Good luck, and we'll see you later.